Weekly segment, Should I Worry?, in which we talk about everything that worries us. One viewer writes, "My medical records are now available online. Should I worry?" Dr. Samadi, your record online, anyone can see this. Should I worry?
Well, there are good things and bad things about this. The fact that the electronic medical record has come into our life has made a lot of things very easy, because simultaneously the patients can look at their records, their labs, and we can also find out what's going on. So in some ways, it reduces the medical errors. We have about 200,000 people that die from medical error every year, and the purpose of this is to really control this and reduce those numbers. So that's really, people can make an appointment online, they have their medications, cuts down on a lot of phone numbers and visits to the office. On the other hand, you have the legal issues going on. The insurance companies, the pharmaceuticals, and a lot of people can get their hands. So some of the privacy, unfortunately, is gone out the door, and that comes with any kind of technology. So don't be surprised if you find out some of the very detailed information, sexual transmitted disease, cancer information can get out there to some of these companies.
Dr. Siegel, can someone take that information and use it against you somehow?
No question. I mean, there's a lot of hackers out there. The Poneman Institute did a study in 2013. 94% of healthcare organizations have had some data breaches. And the U.S. Department of Health reports 21 million data breaks over the past 3 years, meaning that someone got a hold of records they're not supposed to have. Now,
what do they do with them?
It could be, well, because, Eric, Social Security number is there. Private medical information is there. They can get your credit card information, your insurance information. So there's, of course, a financial concern. But there's also the privacy issue. And people in my office, and David's, I'm sure, are very reluctant about this question. He pointed out, though, something really great. I love electronic medical records because we don't end up with a duplication, because if somebody does a test other than me that's on the circuit, that's on the electronic health records, I get immediate access to it. There's less duplication. If we get it inter-institutional between hospitals, it's going to be even better. But I sometimes get nervous. I'm thinking, well, wait a minute. This patient, everyone in the medical center has access to their information. Everybody that can get online in my medical center can get that information.
And there's really nothing to do to avoid this. Unfortunately, the government already has brought this electronic medical record. It's all over the place. And that's really the big problem. What I don't like about the electronic medical record is when I'm sitting, right now I can talk to my patient. I really enjoy that patient-doctor interaction. I want to know what they look like, when they talk about their symptoms, their facial impressions. And now they're turning the doctors into typewriting secretaries. And I just have to ask the question and start typing. That's the part that really bothers me. But we don't have much of a choice.
I also imagine, though, when we talk about breaches, I mean, a hospital medical center or doctor's office can find out exactly who has gone into the computer, I imagine, and unauthorized people could be tracked.
Too late. The information is out there.
And you can't get it back.
Well, there's actually that is going on right now with a lawsuit of a woman who said a sexually transmitted disease she had got online, and they're trying to figure out who did it. They can't always track that down.
Well, she found out about this on Facebook. She found that her information was on Facebook, and by the time she wanted to control this, already thousands of people. So you got to be careful.
To David's point about you sit there and you're entering it into your computer. Your patient's over here, and you're looking like this, and then you're looking like this. Yeah. It's not exactly the same quality of FaceTime that we used to have.
Well, we're happy to have FaceTime with you. All right,
we move on now.
You got it. We're there.